What is a common myth about pee color? A lot of people out there expect their pee to be clear as water, so that's not true. Hi, I'm Dr. Satya from Pantai Hospital Kuala Lumpur. I'm a urologist, so I deal with your kidney, bladder, prostate and genitals, specifically for men. Today, I'll be answering some questions which you may be too shy to ask your urologist. So people say women should always pee after sex. Why? What happens if you don't? Alright, this is a very important question. What happens when you have sex? You have a lot of friction and there's a liberation of bacteria. And the bacteria will find its way up your urinary passage and then get into your bladder, and hence you have urinary tract infection. So how do you get rid of the bacteria which is trying to find its way into your bladder? Simple, just pee after sex, so that when you flush it out, your risk of infection is much lower. I find it hard to hold my pee in. Why? Alright, so there could be one or two reasons why this happens. You might have a urinary tract infection. So you might have pain on passing urine and burning sensation. So if you have that, then you probably need to have a urine test done and appropriate antibiotics and so on. So alternatively, if you have difficulty holding your pee on a long-term basis, and you've probably been treated for a urinary tract infection in the past, you might have overactive bladder syndrome. So overactive bladder syndrome requires investigation, blood and urine tests, and a bladder diary. So you should seek a urologist out to see what can be done for you. Many men don't clean their penis after they pee. Could this lead to any problems like urinary infections? Alright, so this is a tricky one. So most men end up going to the bathroom when you're, to the mall or whatnot, and you end up at the urinal. You have no means of cleaning your penis after you pee. Most times men are not adversely affected because you have got a longer urethra, so your risk of infection is much lower compared to women. And what I would advise my male patients who are uncircumcised is to retract and clean while you're in the shower at least once a day, and that should be sufficient. What is a common myth about pee color? A lot of people out there expect their pee to be clear as water, so that's not true. Pee normally should be a light straw color, and if you do notice that it becomes thicker or towards the tinge of brown, then you're dehydrated, so drink more. And sometimes if you drink excessive amounts of coffee, you would pee brown. You might pee red if you've had dragon fruit the day before, so don't be alarmed. Alright, the other question that we usually have is bubbles in the urine. So bubbles in the urine are not necessarily foam. So when you pee and you notice one or two bubbles in your urine, do not get worried. If it disappears, then it's just simple physics. It's just because of the pressure of the urine. But if you generally have a layer of foam, thick foam, which does not disappear, then yes, you might have a problem. So when does this happen? If you leak protein in your urine, you can form foamy urine. If this happens, then I would refer you to my friend who's a nephrologist who would have a look into your urine protein and decide if there is a problem. Is drinking cranberry adequate to treat my UTI? Well, yes and no. Cranberry cannot treat your UTI, but you can take cranberry to prevent UTI. Specifically for E. coli UTI, it seems to have certain properties that it helps. So cranberry on its own, it's not very palatable, but there are cranberry extracts that are in capsule form that you can take once a day. And this does help reduce the risk of UTI if you are a recurrent infection-prone person. So if you are a woman and you have more than one UTI a year, then that's not normal. Then you should have yourself checked. And it's never normal for men to have a UTI or for children for that matter. I often wake up in the middle of the night to go to the toilet. Why does this happen? How can I fix this? So this is called Nocturia, meaning you wake up in the night to pee. So is this normal? It can be normal if you drink excessive amounts of liquid, but it should not happen consistently. If you wake up every night without having anything unusual, then that's abnormal. So you should be checked to exclude serious problems like diabetes. And alternatively, if you do have other male-related problems like BPH. BPH is a prostate enlargement, and you can be waking up at night to pee because of a prostate issue. If you want to know more about keeping your urinary and reproductive system healthy, I'll be answering more questions on the full podcast over BFM's Health and Living segment. The link will be in the description below. Till next time, bye.